Mummy makeovers continue to be a very popular option for women who want to get their pre-baby bodies back. Is it something you would be willing to do? Cami, a mother of 4, decided to go for it, here on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my care, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Last week we met Cami, a 41-year-old mother of 4 who decided to have a mummy makeover. We've already followed the first part of her journey, the breast augmentation and lift. This week we'll be finishing it all off, but first let's recap what Cami has had done thus far. What is a mummy makeover for you?
For me, it's a breast lift and augmentation,
Okay.
and then a tummy tuck.
This is a special mommy makeover procedure that we're trying to help women get back to their pre-baby image and maybe even enhance that some.
So the first thing we'll do is make an incision here and create a pocket to put the implant in.
I'm a little nervous, both at the same time, but a lot of women do it.
What do you expect?
A flatter tummy and breasts where they used to be when I was a teenager.
Basically what we're doing is taking out excess stretched out skin and tightening the breast tissues, elevating the nipple and areola to a more normal level.
Have you had any issues regarding loss of sensation or?
No, not at all. I feel great and they feel normal to me.
Dr. Clayton is the wonderful plastic surgeon who has been looking after Cami. Welcome back, Dr. Clayton.
Thank you. It's good
Okay, last week we saw how Cami had her breast augmentation and breast lift.
Yes.
This week we're going to be seeing the second part of her makeover. What has she had done?
In addition to the breast work, we did work on her abdomen. She needed a tummy tuck.
Okay.
And so that was the second part of her mommy makeover.
So we're on the second part of the journey.
Yes.
What are we going to see this week?
We're going to see the abdominoplasty and liposuction that was done for Cami as part of her mommy makeover.
Okay. I wanted to ask you a quick little tidbit. How many women come into your office wanting to have the mummy makeover? And is it growing in popularity?
I think it is growing in popularity. We probably see in a month's time 4 to 6 women that are interested in this type of procedure.
Really? Do they all know what is actually involved? Have they done their research? Do they know what's going to happen?
You know, many have. Many have talked to friends of theirs that have had that done, or they've heard about it. They've researched it on the web, either at websites. So many are quite informed about it when they come in. They know what they would like to have.
They know what's happening. They're fully researched.
Yes.
Okay, for people who don't know what a tummy tuck is,
Yes.
talk me through it. What is it?
What we're dealing with is 2 things that have happened during a pregnancy. The tissues have been stretched out so they don't contract back the way they were before the pregnancy. And the other thing is the muscles that normally hold the stomach in have been spread apart so they don't efficiently hold the abdomen in any longer. And so the 2 components of the tummy tuck that we're doing is to get rid of the excess tissue that has stretched out and then to tighten the muscles as they once were.
Is there any way to do this without having cosmetic surgery?
Sometimes I see people that think they may need the full tummy tuck when in reality their muscles are quite good and they don't have a lot of sagging tissue, and perhaps a liposuction of the abdomen is a better answer for them.
So why did you do both procedures on Cami?
Cami needed to have the excess skin that had developed taken out, as well as tighten the muscle back together.
Okay, so what is the difference between a tummy tuck and liposuction?
Okay, a tummy tuck involves removal of tissue that has stretched out or the muscle been brought together. With liposuction, we don't bring the muscle back together. We're vacuuming out fat cells that are in excess but the person doesn't need to have excess skin taken out.
Okay, when you have liposuction, there's been lots of stories out there that it can come back. The fat comes back.
I hear those too.
Is it true?
It only comes back if somebody takes in more calories than they burn.
Ah, okay. So it's like a diet.
Yeah, well, not really. If they maintain their normal nutrition and exercise level, they'll maintain the surgery.
Okay, well, talking about that, who is a good candidate for liposuction?
It would be somebody that has spot areas that are out of proportion, fatty deposits that I can trim down to blend in to their body contours better. It's not a weight reduction operation. So some people are under the mistaken impression that liposuction is for weight reduction, but it's for spot reduction of problem areas.
That's a much better clarification, because people do feel, eat what you want, you know, don't exercise, blah, 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 and then they go in, see someone like you and say, suck it out.
Doesn't work that way.
It doesn't, really doesn't. I wanted to also ask, is there an age factor when it comes to having a successful liposuction?
There probably is. As we get older, our tissues become more lax and stretchy. So when we do a liposuction, we want to make sure that the skin will contract down to the new form. And sometimes people have enough laxity, it doesn't do that very well. So somebody that may be in their 60s or 70s may not have the capability to contract. But I have done people in those age groups that have done very nicely.
Really?
Yes.
I want to talk to you about the risks of both procedures. Now, we've done them both together here on Cami, but let's just talk about tummy tuck. What are the risks involved with that?
Again, there can be infection and bleeding, hematoma. Both of these things are very rare, thank goodness, and we try to do things in a careful way that they don't happen. There could be dehiscence of the repair I did on the muscles. In other words, the sutures let loose. That is extremely unusual. The way I do the repair is not just a single layer of repair, but I do multiple layers on the muscle so that that does not happen.
Okay, liposuction.
Irregularities. One side doesn't match the other. There can be fluid collections, infection. Again, these things are not very common.
Okay. Is there anything that people watching at home that are going down this road for the surgeries, is there anything that they can do to prepare for the surgeries that's good for them?
Well, I think to be in good nutritional shape, because we want to maintain that after the surgery. And also, we generally put people on extra iron so that they can build up their blood count. We know we'll lose some blood during surgery, but not enough they should need a transfusion.
Okay, that's good. That's good. So, Dr. Clayton, we're going to go to a break.
Okay.
And then when we come back, we're going to see your handiwork in action. Stay with us after this break to see the final part of Kemi's makeover. The following footage contains actual surgical procedures. It may be too graphic for some viewers.
Yeah, she has this looseness in here, all of that. So we're going to be fixing this part next. Okay, let's go back now. Okay, now we're going to start on the abdomen. We're going to put tumescent solution into the areas we're going to either liposuction or dissect through these small access incisions I just made. I'm separating the skin with a layer of fat under it in a smooth layer. Okay, now we're going to do the actual liposuction. that will suction the fat out that's been loosened. And you can see the fatty tissue coming through the tubing now. We're just cutting through the skin here so that we can isolate the navel from the rest of the abdominal tissues. So now what we're going to do is come across this lower end here. Okay, we're going to stop bleeding again. So we stop the bleeding with the cautery unit. This white layer under the little filmy layer of fat is the fascia of the muscle. Okay, so that's the layer we're going down to. So this is connecting up over where we were doing liposuction. Lisa's finding the vessels as we come across them and holding them with this pickups so that we can stop the bleeding more easily. So we're lifting up the fatty layer and skin over this area of the muscle right here. There's some vessels in here. Okay, now we're going to do the same thing over on the right side here. Okay.
Be sure to check out the Younger You website to watch full episodes of the show, stay up to date on the Younger You Challenge, and get useful tips and tricks to help you achieve the Younger You.
So we've got this lower part elevated off the muscle right here. What we're going to do now is divide this right in the middle so we can get around the navel safely. We're going to leave the navel attached to its stalk down to the muscle so it can get its blood supply as it normally does from that area. Okay, let us have the marking pen. So I'm just going to put a mark down the center of all this, and then on the separation of the muscle that she has separated, it should be together. So that's why she can't have a flat belly, because the muscles can't hold her in very efficiently when they're separated that far. And this will give us a guide how much tightening we need to do. So now we're going to start putting our stitches in. Let me just put a little local anesthesia in here though. Okay. So this stitch is being put in the tough outer covering of the muscle. And as the separated parts of the muscle are tightened here, it brings the muscle edges together. All we're doing is bringing the muscles so they're touching each other the way they're designed to be. Okay. It's not just the fact that they have loose tissue here, it's that the muscles are lax enough they can't hold their bellies in without really trying to suck it in hard. And they get so used to doing it, they hardly know they're sucking it in. But if they relax, it all bulges out. And so this takes the place of that. This brings the muscles back how they used to be, so they hold the abdomen in nice and flat. This is the catheter for the pain pump. The catheter has local anesthesia in it, so it gives her some pain relief so she doesn't have to rely on the pain pill so much.
Join the conversation on Twitter. Would you ever consider getting a mummy makeover? Tweet your answer to the Younger You TV and see what everyone else is saying.
I think what we're doing is bringing her navel through a new opening here. So what we want to do is determine where it's located under this flap and then bring it straight up. So I make a narrow ellipse to cut that out. And by shortening that navel stock a bit, we can make it more of an innie than one that bulges outward. Okay, this is a drain that'll collect any fluid that might collect under the flap. We want it to come out.
While Dr. Clayton finishes stitching up Cami, I went to the public and asked a few mothers about the pressure they feel to be thin and fit after having kids.
With all the stress and everybody, like all the stars having babies and everything, they want you to get down. You're supposed to be down to a certain size right away, and I just feel like it's been really rough for me to get to that point.
It really isn't a pressure to have plastic surgery, say, but they do want you to be thin, and so if diet and exercise aren't working for you, or it's just something you choose not to do, I think that's really probably the best option.
We all want to get straight back into our clothes we had on before, and everybody's looking at you to see how long it takes to get back into them. There is loads of pressure.
That's food for thought. Let's check back in with Dr. Clayton to see how Cami's surgery is going.
Yeah, So you can see, just comes along here, and like that, and then the navel.
Coming up after the break, we'll be joined by Cami to hear about the procedures we just saw and to check out her final reveal.
Ever since I started having kids, which was 17 years ago, you just watch your body, just things don't go back to normal. Some women it does, they have the good genetics where things tighten back up. But for me, it just got worse and worse with each kid. When I was a teenager, I'm like, who would ever get implants? Plastic surgery is such a Beverly Hills thing, you know. And I would watch Dr. 90210, I loved that show. But over the years, I'm just like, oh, if a woman wants to do it, go for it. I'm not judging her, and I hope I don't get judged. In my head, I'm still 21, even though my body says I'm 41. But I'm just like, fight age as much as you can if it's possible, whatever makes you feel good. I hope I feel more self-confident, and especially in the swimsuit, and not feeling like I'm 4 months pregnant all the time, you know, fit into clothes better, and just have a flat stomach. Once I lost weight and I knew having kids was done, I'm just like, okay, I'm trying to exercise, do sit-ups, tone, and things aren't going back into place. And so the only way to fix that is surgery. And I just want to get to that final perfection in my mind.
Well, we're back in the studio with Dr. Clayton and Cami to talk about the results of her final part of the mummy makeover. Cami, how are you?
I'm good.
All right. You're looking pretty good.
Thank you.
Okay. Last week we saw breast augmentation and breast lift. Okay. This week we've seen the tummy tuck and liposuction. How did you feel having that done?
I'll be honest, it was rough the first couple weeks.
Really?
A lot of pain, but after that I felt great.
What was more painful? Step 1 or step 2?
Step 2, obviously.
Yeah, step 2.
It's more invasive, I think.
Really?
Yeah.
And Speaking of invasiveness, is that really true? Having liposuction and a tummy tuck is quite invasive?
Well, compared to the breast part, it's more extensive.
Yeah.
And therefore, tightening the muscle, I think, is the part that gives you the most pain.
You can't stand up straight
Really?
for the first couple weeks, yeah.
Okay.
You're hunched over pretty much.
And when can you have full movement again after the operation?
We generally like our patients to straighten up by about a week to 2-3 weeks, somewhere in there. But that doesn't mean they can do a crunch in the gym at that point.
Yeah. So you were saying that regarding exercise, you were back in the gym, what, 5-6 weeks later?
5-6 weeks, yeah.
And is that normal, Dr. Clayton? Because she was pretty fit to begin with. Like she you know, she wasn't obesely overweight, and she wasn't doing it to remove huge amounts of skin.
True. That is pretty typical for the tummy tuck part. With the breast part, people are back in the gym maybe more like 3 to 4 weeks.
Wow, amazing. Scarring, have you got much?
Oh, yeah.
Okay, and what are you doing to help that recover?
Well, I still have my steri strips on
Okay.
for another month, I think, and
Okay.
then, yeah, just keeping them covered.
Steri strips are a type of adhesive strip used to close small surgical incisions. The tape gives mechanical support to the scar by preventing the incisions from pulling apart. When steri strips are applied to incisions, it results in less scarring than normal stitches. This is because it puts pressure on the scar to prevent it from raising up. People often ask me, Dr. Clayton, when they're on the shows, about scarring. And is there anything that they can do to prevent the length of the scarring before the surgery? Is there anything they can take? Are there any potions and lotions? What's the deal? Or scarring is scarring?
Unfortunately, scarring is scarring. There's nothing you can do ahead of time. There are different lengths of the scar we do for a tummy tuck, depending on the needs, though.
Right.
And there's such a thing as a mini tuck, a mini abdominoplasty, where the scar is shorter. But in general, we don't tighten the muscles as much in that procedure.
Okay, you were saying that breast lifts can later on droop again and you might need a tightening up. Is that the same with the tummy tuck?
Less so, actually.
Oh, okay.
It's possible, and I'm often asked, well, when should this be done? Should I be done with my family? And generally that's the advice we would give, is you do this after you're finished with your family. But you can actually go through a pregnancy just fine having had a tummy tuck.
Kemi, question to you.
Yes.
What do your friends think? Because you actually told me when I first interviewed you that you weren't going to be telling them.
Right. I've only told a few people, and I didn't want it to be so dramatic and drastic that they, you know, someone could say, well, you've had work done. You know, I wanted it to feel normal.
Okay.
And so, but they've all, the ones I did tell, they've been very complimentary and supportive, so.
Okay, do you feel there's pressure on you as a woman to always look your best and go the step above? You know, there's a lot of pressure on women in society, isn't there?
Yeah, especially if you've had kids. You see the celebrities that bounce back into their pre-baby bodies, you know, and
well, hold on. Well, they've got chefs.
That's
They've got
true.
trainers. They've got the whole thing. They've got Dr. Clayton on speed dial, you know. What did your husband say when he finally saw everything that was put together? He went, oh, there's the wife I married.
yes,
But he didn't think you needed it
No.
to begin with, did he?
no, he's been very supportive either way, so.
And do the kids, your boys, you got 4 boys?
They don't really notice. They're just in their own world. They don't pay attention. They're like, Mommy went to the hospital for a couple days, you know, and she was in bed a lot, you know, but they don't really care. They don't.
Okay.
They don't really notice.
I asked you when we first met regarding being ready mentally, being ready physically.
Right.
How are you dealing with that now? You know, you've said you've had a little bit of pain. It was much harder having the tummy tuck and the liposuction.
Yes.
You had the breast augmentation and the breast lift, and I believe it was like 6 to 7 hours. Is that
That's
right?
right.
And is that the normal length of time, Dr. Clayton, that you would be under anesthesia?
Somewhere between 5 to 7 hours would be
Okay.
pretty typical for that much surgery.
I wanted to ask you one question, and then we can wrap it up. What part when a woman comes into you, or a man, do you ask them about their mental stability, about the reasons why they want to have this done? Does that go through your mind? Do you ask those questions?
Yes, it is. It's a very important concept and question to have answered. And so it's in the first visit that
Really?
as I'm assessing their motivation, why do they want this done? What are their goals? Are their goals realistic? Are they unrealistic? Do I have a good feel about this patient being a good candidate for the procedure?
So when he was asking you those types of questions, were you feeling insecure? What was your thoughts when he was asking you that?
I've had 4 babies, and so I felt very insecure, and it's only benefited me, my self-esteem and my confidence.
Yeah.
So
You said to me
yes.
from day one that your main goal for this is to get back into that bikini.
That's right. I've never worn a bikini. I've always had to hide it, in one piece. So this summer I'm going to flaunt it.
I love it. I
I'm
think
going to be
it's
proud.
fantastic.
So
Good for you. I've always been a believer, Cami, that if you want to have cosmetic surgery, if you want to have anything done to your body, that's your choice. You make those
That's right.
decisions in life. You live by them, and they're your choices. Are you happy with your choice?
I sure am.
You know what? So
No regrets.
exactly, and I love that. Guys, thank you so much for sharing this incredible journey.
Sure.
I think it's been a great success. If you want to find out more information about Cami's Mummy Makeover, head over to my webpage at theyounger.you.tv, and I'll see you next week. Next week on The Younger You, we'll meet Dr. Gordon, who is putting Matthew through a 21-day whole food cleanse. Matthew's going to feel healthier, younger, right here on The Younger You.